Understanding chronic stroke, what brain scans reveal. Have you ever wondered how brain scans can help us understand chronic stroke? Brain imaging is a key tool in evaluating stroke, revealing important details about brain damage over time. The two main types of imaging used are computed tomography and magnetic resonance imaging. Each has its strengths in identifying changes related to chronic stroke. Computed tomography scans are often the first step in stroke evaluation. They are quick and widely accessible. In cases of chronic stroke, a CT scan can show areas where brain tissue has been lost. These areas appear darker on the scan due to tissue death and atrophy. CT scans are particularly good at ruling out bleeding in the brain and spotting calcifications. However, they may miss smaller chronic lesions since they are less sensitive than magnetic resonance imaging. On the other hand, magnetic resonance imaging is particularly effective for detecting chronic ischemic changes. Specific sequences like T2-weighted imaging and fluid-attenuated inversion recovery highlight chronic stroke lesions as bright spots. These bright areas indicate gliosis, which is scarring in the brain and tissue loss. While diffusion-weighted imaging is crucial for identifying acute strokes, it is less effective for chronic cases. However, it can help distinguish between old lesions and new ischemic events. Advanced MRI techniques can also uncover microbleeds and chronic bleeding changes that a CT scan might overlook. Functional MRI and other functional imaging methods can assess changes in brain activity related to stroke recovery or ongoing deficits, although these are primarily used in research rather than routine practice. In summary, brain scans in chronic stroke provide valuable insights. They reveal the location and size of damaged brain tissue, helping to link clinical symptoms with affected areas. They also show the type of tissue changes, such as gliosis and atrophy, and can identify small vessel disease or microbleeds that may affect treatment decisions. Moreover, distinguishing between old and new lesions is essential for ongoing patient care. These imaging results guide healthcare professionals in understanding the impact of the stroke, planning rehabilitation, and evaluating the risk of future strokes. While CT scans are vital for quick assessments and ruling out hemorrhage, MRI is generally preferred for a detailed evaluation of chronic stroke changes due to its higher sensitivity. This approach aligns with current medical guidelines, emphasizing that imaging should complement clinical evaluations. It is crucial for individuals to seek personalized medical advice for stroke management, as each person's experience with stroke can vary significantly.